Congenital heart disease affects about 1 in 100 live-born children. Approximately 25% of the children with congenital heart disease require corrective surgery during infancy. Now, most of these surgeries are usually performed using a cardiopulmonary bypass, which triggers a widespread endothelial inflammatory and coagulation system response. Now, we all know, or has it been postulated before, nitric oxide has been proposed as an adjunctive therapy for children who are undergoing cardiopulmonary bypass surgery, and it is administered into the gas flow of the cardiopulmonary bypass oxygenator. Now, it may also reduce postoperative low cardiac output syndrome, leading to improved recovery and shorter duration of respiratory support. Now, the question here is, does nitric oxide applied to the cardiopulmonary bypass oxygenator compared with the standard care result in more ventilator-free days in children younger than 2 years who are undergoing surgery for congenital heart disease? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about the NITRIC Randomized clinical trial. Now, the international NITRIC trial, that is the nitric oxide during cardiopulmonary bypass to improve recovery in infancy with congenital heart defects, was primarily conducted to test the hypothesis that nitric oxide, when applied to the cardiopulmonary bypass oxygenator, would result in more ventilator-free days than the standard care in children who are undergoing surgery for congenital heart defects. The study that I am talking about was published in the JAMA network. It was a double-blind, multi-center randomized clinical trial that was conducted in 6 pediatric cardiac surgical centers. A total of close to 1,371 children younger than 2 years of age undergoing congenital heart surgeries were randomized with a 28-day follow-up period. The patients were then assigned to receive nitric oxide at 20 parts per million delivered into the cardiopulmonary bypass oxygenator, or compared with the standard care cardiopulmonary bypass without any nitric oxide. The primary endpoint was the number of ventilator-free days from the commencement of bypass until day 28, and there were 4 secondary endpoints, including a composite of low cardiac output syndrome, extracorporeal life support or death, length of the stay in the ICU, length of stay in the hospital, and postoperative troponin levels. It was then found that a total of 22.5% of the nitric oxide group and 20.9% of the standard care group developed low cardiac output syndrome within 48 hours, needed extracorporeal support within 48 hours, or rather died by the end 28. Therefore, the authors concluded that these findings do not support the use of nitric oxide delivered into the cardiopulmonary bypass oxygenator during heart surgery, meaning that among the infants who are undergoing heart surgery, delivery of nitric oxide into the cardiopulmonary bypass did not increase the ventilator-free survival censored at 28 days period. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.